You know that feeling that you have in the pit of your stomach when you wake up in the morning to go to work?
I do feel as though my job has become very stressful over the years.
I just feel like the scheduling for the job wasn't done correctly, so it was just completely stressful all the time.
The stress is getting there. You're like, okay, I gotta go. I need to go. I
don't know anybody who doesn't have stressful work.
Stress is a well-known term. People tend to accept it to some extent, that this is the way it is. But when stress becomes chronic,
extra worry at work may actually trim a couple years off your life.
Aspects of the work environment which we've documented include effort-reward imbalance, job strain, lack of justice in the workplace, work intensification. A long list of variables are associated with the development of hypertension and cardiovascular disease.
these kinds of stressors, are really difficult to live with on a long-term basis without having some kind of impact on someone mentally or psychologically or physically.
There's something about modern industrial society that is a contributor to hypertension. Among hunter-gatherers or agricultural communities, there's virtually no hypertension, and that blood pressure does not rise with age.
In what I do for a living, you never have enough time and you never have enough resources.
During the bad times, we can work in excess of 55, 60 hours a week.
As a result of the stress, at the end of the day, you're mentally exhausted. When you're mentally exhausted, it kind of takes the toll on the body.
At all levels of the society and for all jobs, people are being asked to work longer and more hours, and this applies to white-collar workers as well as the blue-collar workers.
I mean, I don't know, you just got to get the work, put your head down and get the work done,
Even when we were working our butts off, it was just kind of frustrating because it's like you put in all this effort and no one really notices.
You put all this effort into the work, and what do you get back? And we are interested in situations where you put lots of effort into work, but what you get back is not sufficient or not even there.
I think that work in America is getting worse. I think since the recession in 2008, we've seen a marked increase in involuntary part-time work, for example. More people say on these surveys that they're working part-time, but not out of choice. They're working part-time because they can't find full-time work.
When I got hired on, they say if you work here long enough and your productivity is good and you do well, then eventually you get hired on at full time, and it just never happened. If you worked over 40 hours, then they'd have to pay you overtime. They wouldn't allow that. Technically, we would be working close to 40 hours a week, but we weren't getting the benefits of working full time.
We also see an increase of job insecurity, not only among the most deprived people, but also in middle socioeconomic positions. There's a huge pressure, in particular in the high-income countries, to pay adequate salaries. So there is a pressure for employers to restructure their work, to downsize their firms.
We think that this 24/7 economy is having a really brutal effect on people's well-being, and we may see it in years to come have a greater effect on the cardiovascular health.
I love what I do. However, my body, the stress that it takes on the body.
And then you start getting stomach problems because, all the worry, all the, oh my God, what to do?
And you think, okay, well, I'm dealing with it pretty good, but are you really?
Maybe you're ignoring your symptoms because you feel pressed to get your work done and you're not going to see the doctor. All of that plays into it, in addition to the stress of the job itself, which increases adrenaline and cortisol and these hormones that raise blood pressure.
You have stress hormones in the body which prepare you to fight or to fly. And fight and flight is not possible at work. So then the stress hormones accumulate in your body, and in the long run they do harm.
While everyone shows some increase in blood pressure when they go to work, working people show bigger rises in blood pressure when they have rather unique working conditions. Job strain, work with high demands and low control, leads to people facing huge demands at work, feeling as though the amount of control they have is inadequate to be able to do a good job.
I think the things that made me feel most anxious at Walmart was how stressful it was with how long the lines would get, because we would be a little understaffed. We would only have so many people working, so our lines would just grow really long and the customers get very irritable.
I feel like management doesn't really cater to the employees. If an employee has an opinion, they're like basically told to shut up and do their job.
They need to give me 25 minutes from here to here. They give me 30 minutes, actually in the paper. 30 minutes is nothing.
People with very demanding jobs but without adequate control over their working conditions have higher blood pressure. And not only higher blood pressure, but also increased risk for a heart attack.
What they found is that those who had a higher degree of job strain actually were at 40% increased risk for overall cardiovascular disease, and as you said, Maggie, an 88% increased risk for heart attack.
The medical profession itself has tended to ignore the possibility that social causes might be causing stress among people.
The U.S. is the only industrialized country where workers are not legally guaranteed minimum vacation time.
Why do we do this to ourselves? Well, the conventional answer is that this attitude towards work makes the American economy the envy of the world.
What businesses might want to justify as, quote, oh, they need to have some demands put on them, ignores that there is some limits to what the human body is capable of dealing with.
Productivity can drop up to 50% in the hours that are overtime hours. Not to mention the fact that stress-related costs for business is $407 billion a year.
Just as in the past, we limited the exposure of coal miners to coal dust, and with the Occupational Safety and Health Act, we limited workers' exposures to toxic chemicals in the environment. We now need to extend those legislations to limit the exposure of working people to psychosocial stressors at their workplace.
In France, for example, we have a psychological stress test required by law. I have not seen that in the US.
If they were to hire managers that actually cared, they would see, oh, well, these workers are being overworked, or let's move some of these workers from this shift to this shift.
I think it's empowerment. I think it's important to trust your employees and to know, to let them know that you have faith in them, that they're doing a good job. Because when we're empowered, we do our best work.
If I could change anything at Metro, did you say anything? Get on those buses with us and see what we deal with every single day.
It is not sufficient just to focus on individual health behavior. This all should be complemented by structural changes of the quality of work and employment.
I think unions work hard and are often the only cases in which working conditions have been addressed. Workers have unions to try to give them a voice, to try to make a difference.
We will not be silent! We will not be silent!
People are all over the United States as examples of people organizing to try to improve their working conditions and their wages.
What do we want? 15! When do we want it? Now!
Giving them the language to express themselves and giving them the evidence that it really matters for their own health. These are two very powerful steps.
Collective bargaining, binding arbitration allows us to negotiate the terms that make us able to come home from the job at night. And without it, who knows what will happen.
I feel now the burden on researchers and on people in public health is to educate everyone as to what we've learned so that we can see a change in social policy around work.
We shouldn't turn our back on this as an inevitable part of work. This is a problem that can be addressed. Americans deserve healthy work.
If you want life, liberty, and the pursuit of healthy work, adopt our agenda for healthy work in America. Join the healthy work movement and visit workingonempty.org for more information.